Dr. Nandini Pasi, good morning. Welcome to the show. How are you doing?
Good morning, Vinod. I'm doing fine.
It's great to have you here. So, I'm just going to read about your accomplishments to the audience so that I think it's going to take a bit of time because it's a pretty long list. 26,
You don't need to
Dr.
read all of it.
I'll give a highlight at least. Even the highlight
Okay,
is
okay,
quite long. So over
okay.
26 years of successful private practice in implant dentistry, full mouth rehabilitation, smile enhancement, and complex prosthodontic treatments. Mentor at ACAD, Academy of Dental Education, guiding UG, PG students and practitioners. Apart from that, you are a member of Indian Prosthodontic Society since 1996, Executive Committee member, IPS, Vice President of IPS, Organizing Secretary in Chandigarh, Founder President of IPS Chandigarh branch. And in terms of academic experience, you are MDS Prosthodontics from KLE, Belgaum, 1999. 26 years of stellar clinical experience, academic leadership, and contributions to national professional bodies. Dr. Nandini, it's a pleasure to have you here.
Thank you. Thank you, Vinod. Thank you for such wonderful introduction.
Okay, great. I think so. I'll start off with a couple of basic questions. Why did you choose dentistry and why this specialty prosthodontics?
Prosthodontics involves everything, Vinod. It is art, science, and skillful job, Prosto involves everything in dentistry, like, for example, aesthetics, anything missing, you replace. Not only teeth, it may be nose, it may be eye, it may be ear. So it is said that God creates and prosthodontists recreate it. So I really like the fact of it recreating, and so I chose this subject, prosthodontics. I'm very good at it, artistic work. I create good stuff. What is spoiled, I create and make it best,
Got it.
which is why it was my interest subject.
So let's say when you were doing BDS, did you already know that you had to do prosthodontics, or was it something that you figured halfway during your course?
No, actually, you have a total of 8 subjects while you do your BDS, you know. So these 8 subjects, clinical work you do at the end of the course, that is in the final year, some of it in the third year, and most of it in the final year. While you do attend the patients, you get to know. So you are good at it and you can really do it. And at that stage, at that age, you are not that, intelligent enough to make a good choices like that. But this was the best branch I could take, and I had interest in this. A lot of people don't like doing prosto work, but it's hard work. It is not easy. The prosthodontic work is very, very hard. Its exam itself is for 2 days and 2 nights. You go through the hell out of a job to prove yourself that you are good at it. So it is
Got it.
that way.
So if you have to explain prosthodontics in a very simple manner to audience who don't know anything about dentistry and prosthodontics, what would that be?
As I told you, prosto is that branch of dentistry which involves replacing the missing head and neck, craniofacial, whatever organ is missing, that we replace. And not only replacing that particular thing, maybe if it is, for example, teeth, it is not that you only replace the teeth, it you replace the function of it, aesthetic of it, everything you have to take into account while you are replacing something in the head and neck. If it is nose, then again, aesthetics. Nose, it may not be functionally viable, but definitely you cannot block breathing. You may create a nose and you airway is clear. So it is aesthetics, it is replacement, and it is functionality,
Functionality.
and it is maintainability. It is a lot of things involved. Functionality, yes, of course, a lot of things involved. Nobody will like to have best aesthetic teeth and they are not functioning well. They are either sensitive or they're overcrowded. You are not able to, most of the questions the patients ask you that, will I be able to bite my apple? Or if it is posterior chewing, they are usually bothered about.
Mhm.
So all that has to be replaced, not just replacement of tooth, you know.
So if I
So
if
that
I
is prosto.
summarize,
It involves a lot of art and science.
got it, got it. So if I have to just summarize for the audience,
Yeah,
it's aesthetics, it's functionality, and also right from neck till the head, the parts that are replacement. That's what you get involved in. It's
that's
quite
right. That's right.
looks quite intricate,
Interesting.
and it looks interesting because I'll tell you why. Because I didn't know this before I even got into the call. I thought it was only to do with, let's say, replacing something as part of your mouth and teeth is was my understanding from prosthodontics. But the way you explained, looks like it involves nose, face, head, and cheeks, and other parts of the face, which is interesting to know, of course.
We are called not prosthodontist, we are called maxillofacial prosthodontist. So
Ah,
it is maxillofacial prosthodontist. You study head and neck. You don't just study oral cavity, because a lot of things are interrelated. Head and neck is interrelated to your teeth, your oral cavity, and a lot of it is connected. So craniofacial, the entire study makes you a prosthodontist, makes you a dentist for that matter, the basic dentist also. Study all this. Anatomy, you need to study head and neck.
looks like you have to study a lot then.
Oh, yes. Medical line only, you have to study a lot, Vinod.
Okay, great. So, typically, what is your patient profile, Dr. Nandini? Like, what kind of patients get referred to you, or what are the type of people who come to you?
Uh, all sorts of patients we have in our clinic, Vinod. It may be just a cleaning, it may be filling, it may be root canal. It is also full mouth rehabilitation, as you read it out in my CV. I do a lot of full mouth rehabilitation cases and smile enhancement. Um, lot of treatment varied are involved in dentistry. So patients sometimes come for one small thing that you end up noticing 10 other things. So you suggest to those patients that this is just a emergency situation, but you have multiple other things. So that's how you have a lot of treatment planning that you give to your patients. If, for example, you have come to me for the small filling because that is hurting you, but when patient enters into your clinic, you just don't see that particular, of course, that particular thing you treat at that very time, but rest of the thing, oral cavity is examined always, and patient is always told that these are the problems you have, so get it sorted. Maybe wherever you are staying, not necessarily it is, but it's our duty to tell the patient that, once they have walked into your office.
Okay, interesting. Uh, what I'm also
Hmm.
interested to know, Dr. Nandini, is I mean, taking your specialty into account, let's
Yeah.
assume that people want some changes to their maxillofacial structure, or some kind of repair work or replacement work, whatever that entails. And then there are people who come for aesthetics slash functionality, for example. How would you categorize, or let's say give certain percentages to the type of people who come, not for basic dentistry purposes of cleaning and filling, but from a reconstruction or repair or functionality perspective? How would you segment them?
Maxillofacial, for example, if it is a surgery, then it is particularly, maybe it is due to some accident or
Hmm.
any fracture in the jaw. That is the only incidental base.
Okay.
And aesthetics and full mouth rehab has become very much like a choice these days the people make, that people are very, very conscious about their aesthetics. And about orthodontic treatment, for example, if there are any crowding patient at early stage want to go for orthodontic treatment. Awareness has increased definitely, Vinod. As far as the dental health is concerned, has increased. So ortho is a different ball game altogether. And full mouth, at what age, what are the other problems patient is facing, and how long you're going to be serving with that full mouth rehab treatment to those patients. So like that, you categorize. As far as percentage of patients concerned, definitely maxillofacial surgery are very less.
Okay.
And in doing a lot of full mouth rehab and smile enhancement, you end up doing all the small treatment, that is cleaning and small fillings, and if any root canal required. So they are, byproduct of that major treatment planning. It depends like what kind of a practice you have. If you are doing full mouth, then everything involves in that. It may be sometimes you want to move a small tooth to have that best aesthetics. So ortho is also involved. If there is a
Got
lot
it.
of calculus, then cleaning is also involved. Filling is also involved. You cannot avoid anything if you're doing full mouth. It's like that.
Got it. I think that very clearly explains that there is more awareness of dental
Oh,
hygiene and the way
yes.
they look. And I
Oh,
understand from
yes.
you that people are more concerned or wary of the aesthetics aspects of it, and let's say smile and reconstruction or decrowding of I think that I have two follow-up questions. I'll start with one. This has been my
Yeah.
observation in the last, I think, 7 to 8 years or 7 to 10 years, that during our generation, the number of people who had reasonable set of teeth and smile was quite normal. I mean, we no, not many people had to go to the dentist for, let's say, smile correction or teeth reconstruction, or let's say the crooked teeth or crowding. But what I see, at least in the society that I live in, which is a large 3,000 apartment society, is almost every kid is wearing braces. And when I talk to the parents, or when I took my own kids to the dentist for braces and corrections, what they say is this has been a very recent phenomenon in the last 15 to 20 years, that a lot of kids have crowded teeth. Now, what do you think that is?
Um, One earlier, people used to have, how what sort of a food, definitely food is a major factor which is playing a role. Earlier, आपने देखा होगा गन्ना 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 जूस
Yeah.
देते, sugar cane also. Have you ever seen anyone doing that in this generation? No, nobody does that. And a kind of fibrous food, earlier people used to, our ancestral food habits were so much different than the present food habits. Here we are, this generation is having only soft food. You don't have to chew. And while watching TV, they are eating. They are not bothered how much they are chewing. You know, our jaw development requires a lot of stimulation, Vinod. So if that is
Mhm.
not there, soft food you are eating and you're just, having something which you don't have to make an effort to digest. So all those processed food also they end up having these days because the parents are working and they just give all these processed food to the children and go. So what is happening is like jaw is not getting that kind of stimulation because the children are not chewing, and developmental stage, it is because it's not getting stimulation, so it's not developing well. You
Its jaw
understand?
is not developing well.
Exactly, because jaw for development requires good stimulation, good movement, fibrous food, chewing, and whatever teeth are developing, jaw is developing. At that time, the bone formation happens only when you're stimulating it constantly. If there is no stimulation, if only soft food is being taken, there is going to be even some of the environmental factors. For example, uh, the mouth breathing, your nose is
Hmm.
blocked because you are having a cold cough and all, because of this environmental pollution. So your nose is blocked, so you end up breathing from mouth. The major cause for the maldeveloped jaws is mouth breathing also, Vinod.
Got it.
What happens is that your tongue is suppressed below and it is not stimulating the palate, the maxilla. It is not pushing the maxilla. So the right amount of pressure is not there on the jaws. So they don't develop well. And having said that, the teeth size remains the same as our ancestrals had.
Ah,
There's no change in the
okay.
teeth size.
Mm-hmm.
So what is happening is jaw is becoming smaller, teeth are remaining in the same size. So they're getting the space less to while they are erupting. So they move here and there to erupt. Everyone wants to come up in the oral cavity. They don't have space, so they crowd each other. They fall on each other. So that's how it is. The crowding is happening more as generation. This is a evolution in orthodontic branch in dentistry. Yeah, that
I
is
think
happening. A
this
lot of
is,
orthodontists are making a lot of money.
yeah,
They
it
end
looks,
up making.
it looks like windfall time for orthodontics and prosthodontics, because I think let's say this, no, processed food and soft food is the trend of the time, and I don't think people are eating gannas and chickis and other stuff much. So yeah, I think I have two follow-up questions, Dr. Nandini. One is, how much of genetics play a role in people's jaw and teeth development? Let's say based on how the
Okay.
parents or grandparents are. And second one is,
Okay.
for let's say if somebody, or if some parent, new parent wants to avoid this for their child, till what age do you recommend them to do, let's say, jaw exercises in such a way that their teeth formation is better?
Okay. Some of my patients also come and say that my grandfather had such good teeth, my father had such good teeth, my parental side, everyone had such good teeth. Why I am having such bad? Yes, we know definitely the genetics play a role, but in what aspect of dentistry it plays a role? The enamel, the outer layer of the teeth,
Yeah.
if it is in certain way, certain strength it has, it is from your generation, it is from the genes.
Okay.
But you end up spoiling it by having a lot of sweets, by not brushing. Yeah, so genetics definitely play a role, and but environmental factors changes that setup, like genetics, genes, you get good stuff, but you end up spoiling it by not taking care. Your gums are not clean because you don't brush twice. Your teeth are not clean because you end up having a lot of sticky food. So these are the factors which make it look like genetics don't play a role, or hereditary is no factor to be considered in this. It is definitely 50 to 60% genetics play a role, and rest all is how you maintain it. It's like that.
Okay, makes sense. And to the second part of the question, please, on jaw
Second,
exercises and
again,
all.
the disconnection was it? Acha, exercise you asked? Is that
Yeah, I mean, I want to understand
what sort of
yeah, obviously, if you said jaw exercising is very important for the teeth to grow normally. And so if somebody had a kid who's like, say, 6 month old, 1 year old, what would you recommend that parent to do so that the jaw development is adequate?
jaw exercise is totally altogether different thing than while eating, you give that stimulation
To,
to the jaw development. So exercise, what you would do, max,
mm,
open, close, move this side, the side. That's your giving exercise to your muscles. Of course, muscles play a role while teeth are being erupted. There is a zone in which the teeth erupt. If your cheek muscle is overacting, over active, then your teeth go inside. Your tongue is overactive. Tongue pushes it outside. So that kind of exercise, how much you will do? Morning 1 hour? That wouldn't help. It is like eating habits, and every time you eat, every time you chew something, even chewing gums, habit breaking appliances are being given to the children these days. If there is a mouth breathing patient, thumb sucking, you keep pushing, your upper teeth comes out. So habit breaking appliances are given. Exercise as in only the fibrous food and good hard stuff you keep eating. Do not have soft food or junk food that we end up having. That it changes the game altogether.
got it. So to
Yeah,
summarize, you want them to eat good, healthy food where they can chew quite a bit.
correct, correct.
Okay, fair enough. I think,
Ganna juice, wow, sugarcane.
yeah, yeah. Okay, cool. Makes sense. I think you also mentioned with increased awareness on, let's say, how people are looking at today, people even talk about looks maxing and, facial corrections, etc. I want to talk a little bit about the aesthetics part for the next few minutes. So I want to understand, how does a bad smile, or let's say not a perfect smile, or a wrong set of teeth affect the confidence of males versus females? Since you get all kinds of patients, you can give some distinction and knowledge into that sector.
As far as aesthetic is concerned, there's no question whether it is male or a female. They're all conscious, Vinod. They're
Mhm.
all wanting to look good,
Mhm.
you know. Definitely, some percentage, maybe females are more conscious, but since awareness is there, even male members are conscious about how they look and what, more so because they are socially exposed more. So aesthetically, all are conscious, male, female, immaterial, you know. So is that what you wanted to know, whether it is a different
Yeah, so that is one
gender
part.
biased?
No, not like that. I mean, I want to understand how much does it affect their confidence when they come to you, both male and female. I want to understand the psychology and what they go through as a human with, let's say, who has a bad smile or a, let's say, an imperfect set of teeth, for example.
Yeah, yeah, they are not confident. They want to correct it because they don't smile. They keep the hand like this, and they're all the time conscious. And sometimes bad breath also causes them be conscious. Aesthetic crowding causes them, conscious about this thing. Both are all sorts of patients we get, those who are not conscious at all. Sometimes I get diastema, it is called, the space between front two teeth. There is a gap. And if I tell patients that I can fix this, they don't want to do it. One, they believe that they'll have a lot of money if they have that space in between the central incisors.
Really?
That's a myth. That's a belief. Yeah. People say, no, 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 no. मैडम ये कराऊंगा मेरा पैसा कम हो जाएगा मेरे पास बहुत पैसा आएगा इसके वजह से. One is that reason. Another one is they're not conscious at all. And a third one is, I'm married, ma'am. Now it doesn't matter. That is another thing that they say. So that is how it goes. All sorts of, temperament people are definitely aesthetically more conscious, male, female, immaterial. They're all
Okay.
conscious about. Yeah.
That's interesting. I think that trend is probably changing. So one of the things, doubts I've had, which slowly is getting dispelled, which I think you can answer better, is there used to be a time when we grew up on, let's say, your age and my age, where people thought up to a certain age there was development of bones and, let's say, tooth arrangements, etc. And they said beyond this age, it is what it is. You cannot fix anything. But what I'm seeing now is, adults, people at 35, 40 wearing braces, corrections, etc. Has the perception changed, or has science changed? What would be the reality here? Because I see people getting corrections at a middle age, later age also, and changing their
Yeah.
arrangements. What has changed?
Yeah. See, ideally, how we evolve, how the teeth erupt is till 6 years, you have milk teeth.
Okay.
After that, till 6 year, all milk teeth are erupted in your oral cavity. They start shedding after that until 12 years, all your permanent teeth erupt and milk teeth are shedded off. After 12, the complete development of teeth set and accordingly the jaw goes hand in hand. They say orthodontic treatment, if any correction requires, you do it after 13 years.
Okay.
There is one stage, it is called ugly duckling stage, Vinod. Ugly duckling stage is something like you are having ugly duckling, you are having mixed dentition. The milk teeth are shedding and the permanent teeth are erupting. So that creates ugly duckling stage. You complete that. You do not suggest any orthodontic treatment during that ugly duckling stage. It looks crowded. It looks dirty. It looks obviously very funny. You do not end up doing orthodontic treatment. You complete the complete permanent set of teeth erupt in the oral cavity. That is maybe 12 years and after that to 13 years. Then you suggest orthodontic treatment. That's a correct way of doing it. Having said that, even till 25, 30, also your wisdom tooth is erupting. 30, beyond that also. Any stage, as much your jaw is giving that permission to erupt, space to erupt in that space. It's a compressed jaw. It may not erupt at all. If it is horizontally placed, it can push rest of the teeth and create the crowding in the anterior region. That can also happen. So 25 to 30, beyond, the development is still happening. The eruption of teeth is still happening. They say throughout your life, your teeth erupt. For example, you pull out one tooth, the opposite antagonist keeps erupting. No, it moves here and there as well. It keeps erupting. If you take out the side one, it might tilt this way, which means it is constantly erupting. It is constantly in the move. If the upper one is not coming down, it's because the lower is stopping it. If the lower one is not going up, the upper is stopping it. The antagonist you pull, it goes. Supra eruption, it is called. So it grows into that space. Supra eruption. So we end up doing enameloplasty, chop, 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 bring it to the level and have the upper tooth placed there. So you have to do a lot of circus. So once you lose a tooth, immediately you report to the dentist. They can correct it in the best way. If you delay it for a year or so, then you end up losing a lot of it and a lot of treatment involved in that. Okay. So orthodontic treatment can be done at any age after that. It depends on the kind of push and pull that you have to give to the bone to make that tooth move. It's basically simple funda. Even 60 and above also patients go for orthodontic treatment. In some of the full mouth rehab cases that I need to move just a 2 or 3 teeth, I do that. And there is something called space maintainer that you give. If supposedly your deciduous tooth is gone well before the time, maybe this was caries or this had some, accidentally broken, you end up removing that milk tooth before it was supposed to be whatever age it was supposed to be exfoliating. So what you do is that below that only your permanent teeth are coming. So permanent teeth, if that is aligned to come, say, for example, after 3 months, this sheds and this comes into that place, they are set. They are in sync with each other. This goes in the first month only, for example. 2 more months are there for this to come because this is trained to come after 3 months only. So what it does, I have got a space now, I have to move. This keeps moving, maybe somewhere here and there. So that space has to be maintained so that this comes right on the space. So that is called space maintainer, that is given by pediodontist, and then orthodontist correct it later. Understood?
What's the other dentist? Periodontist.
Pediodontist. It's a pediodontist is a children specialist dentist.
Got it. Pediodontist.
Child specialist dentist. Yeah, pediodontist. So
okay, got
they are the ones which they maintain that space, and then eventually the correct space, the tooth comes, and that can be, utilized. That space can be utilized. Otherwise, maybe that space gets closed, and the permanent tooth may not erupt only. So impacted. So this needs that particular space. I am coming. You give me that space. It's like that.
Got it.
So that's how the.
How would anyone know that they have space for their teeth to grow or they don't have the space? Is it done through X-ray or how do you find that out?
No, we know that chronological exfoliation. So from first year to 6th year, all teeth erupt, and this one is removed at this stage. This one is automatically they are exfoliating. You don't do anything. Your milk tooth is all created by God. You milk tooth go and your permanent tooth come. If God's equation is changed by chance if it is 6th year that you have to remove instead of that, it goes on the 4th year only, then create that appliance maintainer, a space maintainer appliance. You place it on the child's mouth so that your permanent tooth comes up in a very right way.
Got it. Got it. I think probably I think one takeaway I've had in the last 5 minutes is that people of any age, they can feel confident that they can go to an orthodontist or prosthodontist to get their alignment and smile and everything corrected, irrespective of what their age is. That's what I understand.
Oh yes, they can do it. They can do it. It's
I
got
think
nothing to do with technology. This was always there. It's just that people are aware now, they're getting it done like that. Earlier, people used to say that मेरी तो उम्र हो गई है, मैं कहाँ से ये सब कराऊंगा, was the attitude. Now, मेरी कहाँ उम्र हुई है? Even 90 years old patients, I give 12 implants. Patient is wanting to have, patient is not aware of what treatment is being given to her. And she feels, first I gave her the upper implants. And while I was giving the lower, she was not even sensible enough. She was not even, having that presence of mind. She said, Madam, आप पहले ऊपर वाले करो. I've already done. She doesn't know. In the
oh,
previous appointment, yeah. Children are wanting to have their parents' treatment done. Those who are settled abroad, especially, they come to down to India, get the whatever best treatment possible to their parents, and that's how they are contributing to their parents. This is a trend, especially in Chandigarh, where I'm practicing. Though mostly children who are settled abroad come back, get that parent treatment done, and and that's a sort of care they give, and they go. That's
that's
how. So 90 years, 90 and above. I've given implants, 12 implants also. Me and my husband do a lot of implants in our practice. So we have done all sorts of age group
I
treatments.
think that's very, very interesting. I think I have a couple of more topics to cover, and we'll do a part 2 session as well. I think it's been very interesting. And then one thing before we end the session is just tell audience which foods are good and bad for teeth. Which foods are good
See,
and bad for
food,
teeth, and then
food,
we'll yeah.
yeah, yeah. Food, anything which is definitely sugar is big no-no for teeth, and sugar plus if it is sticky, which is why toffee, chocolates, they say no, don't eat those, because what happens is these sticky, sugary stuff gets stuck onto the tooth surface, and they mingle with all sorts of bacteria and saliva, and they start eating up your tooth surface. So sugary
Mm,
stuff and sticky stuff, big no-no. And even carbohydrates have a lot of sugar in it,
sugar.
so that also causes a lot of caries. And anything like salads that wipes off the tooth surface. Salads, ghanna, again, I told you, sugarcane is the best thing if you keep chewing that. And anything which cleans your tooth surface is always better, which there is no stickiness in that nature of that food. It's the best.
That's good for your teeth.
That's best for your teeth. Yes, you
Awesome.
don't even brush. You keep eating your salads. Wonderful. I don't
Really?
mean don't brush, but yeah, I mean it is very effective. Along with your brushing twice a day. So that is
Yeah,
definitely
I think I get what you're
yeah.
saying. Brushing, of course, you clean your teeth, and if the food can do it by itself, it's almost like let's say a proxy for brushing is what probably you're trying to
No,
explain.
Vinod, I don't say don't brush. Do brush and then have salads. That's what I mean.
Awesome. Awesome. Great. Dr.
Yeah.
Nandini, it was a pleasure having you and understanding particularly the truth, the structure, the stages of growth and realignment, the prosthodontics aspect. I have a lot more to cover in the next session, particularly the impact of, let's say, dental hygiene and tooth and how it impacts other organs in the body. I think people are not aware of it. I would like to go deeper into that. And I want to talk about tongue health, gum health, and aspects that even
Sure,
I'm not aware of. I would like to learn that in the next session with you. I'll schedule it for the coming week. Um,
sure,
and
sure,
then we'll go
sure,
more into foods, specifically list down what foods people should be eating to maintain a good white teeth, or what kind of things or cavities things form that it can be avoided, etc. So that will keep it for the
sure,
next
sure.
session. But for now, wish you a fantastic Sunday. Thanks a lot for coming here and
Thank you.
enlightening us
Thank
with
you,
your
Vinod.
knowledge.
Wonderful, wonderful having a conversation with you, Vinod. Definitely, we'll do the next one, whatever you want to ask. That's my interest topic also. How the oral cavity and all affects the rest of the body, rest of the general medical health. That it's beautiful research work is going on those. So we can definitely have a discussion on that. Yeah.
Okay, let's
Thanks,
do that.
Vinod.
Thank
Thank
you
you.
so much.
Have a
Bye.
good day. Bye.
You too.
Bye. Bye.